Good morning, guys. That's right. We're here today at the Colorado Springs Dermatology Clinic on the Mohs surgical side. On the way, we're talking to the experts about why where we live increases our risk of skin dangers. That is coming up next. Hang on.
525 now. Living in Colorado, we know how our skin can be affected with the changing temperatures, altitude, sun exposure, and of course the dryness.
And the wind blowing against your face too. This morning, Craig Coffey at the Colorado Springs Dermatology Clinic sharing more about this common concern for so many. Good morning, Craig.
Kimberly and Justin, that's right. Good morning to you here on the Mohs surgical side. Did you know that where we live actually increases our risk when it comes to healthy skin and skin dangers? Right now, we're here with Dr. Sneezek. Good morning to you.
Good morning, Craig.
And we really live in a dangerous place, don't we?
We absolutely do, even though everybody touts the beauty of our surroundings. There are really two issues that are involved with skin cancer where we live. So it's not only the duration of sun exposure with over 300 days of sunshine that we receive a year, but also altitude plays a role. With each 1,000 feet of elevation, we receive about 4% more radiation than people do at sea level. So living here at about 6,000 feet, we're receiving 25% more ultraviolet radiation, which is what causes skin cancer.
So when you go to the high country, you go skiing as well, your risk even intensifies.
Absolutely. So in the high country where elevations are 9, 10,000, 11,000 feet, we're talking almost 50% more radiation. But it's not only the radiation, it's also the reflective surface of the snow that even doubles that risk.
Okay, so in Colorado, at the high elevation, in wintertime, we're really on high alert.
Absolutely. It's not only the sunny days, but also the elevation. We receive UVA, which is radiation year-round, and so that's not filtered out by the ozone layer.
So what are the differences then in the rays that we should have exposure to and that we should limit our exposure to?
So UVA and UVB are both the carcinogenic types of or skin cancer causing rays. UVA is not filtered out on cloudy days. So even when days such as today when our weather's not sunny, we're still receiving skin cancer causing radiation. So it's really recommended that sunscreen is applied every day, not just on the sunny days.
Okay. Also, let's discuss when it comes to skin cancer, obviously, we should always be checked out. What are some signs or things we should look for on our body that might be a warning sign?
Certainly any new or changing skin lesion, whether it's brown, pink, tan, an area that tends not to heal, meaning that you have a lesion in a spot that's itchy or bleeding and maybe will heal for about 2 weeks and then all of a sudden will come back and redevelop in the same area. Just a non-healing area greater than about 4 to 6 weeks should be looked at.
Okay, on the way we're going to talk more about the options that you might have if you do find something. Again, this is the Mohs surgical side of the Colorado Springs Dermatology Clinic. That's coming up in just a bit, guys. Back to you in studio.
All right, I want to know about this.
Absolutely,
Dry skin is such a huge concern for me, too.
Absolutely. Good job. Thanks, Craig.
Thanks, Craig.
Good morning, guys. Live today at the Colorado Springs Dermatology Clinic on the Mohs surgical side. Coming up, we talked about the increased risk of skin cancer because of where we live. We'll talk about your options. That is coming up next. Hang on.
5:43 now. Dry and itchy skin can be a daily inconvenience for many of us.
And this morning, Craig Coffey continues our coverage on protecting your body from the effects of our dry environment. Good morning, Craig.
Good morning, guys. That's right. Talking skin cancer right now. And did you know, last time we just learned that for every 1,000 feet in elevation, we receive a 4% increase in the risk of radiation. Did not know that.
Interesting.
Yeah, so we're back now with Dr. Sneezek right now.
Sneezek.
Yes, good morning to you.
Morning, Craig.
On the Mohs surgical side of the Colorado Springs Dermatology Clinic. So let's talk about skin cancer and options, what we might have. First of all, what is Mohs surgery?
So Mohs surgery was named after Dr. Frederick Mohs, who's the surgeon that came up with this technique. And essentially, it's a very tissue-sparing surgical technique where we remove very small pieces of tissue and then process them in our lab while the patient waits in our office. And we can, it's a way of tracking skin cancer and minimizing the amount of normal tissue that has to be removed. So it's really the most, I would say, as far as the technologically advanced treatments of skin cancer,
Right.
that Mohs surgery really is at the top tier.
Do you still have to get the margins and go, and get a certain amount of the area, affected area?
Absolutely, and,
Okay.
and that's the beauty of the procedure, is that we're not only checking the peripheral margins on the skin, but we're checking the deep margins as well. So of any treatment modality for skin cancer, Mohs surgery has the highest cure rate, so over 99%, or conversely, the lowest recurrence rate, meaning less than 1% chance once someone undergoes the Mohs procedure that cancer would ever return.
Okay, so if someone is looking for the Mohs procedure, is that more for those people affected by, I guess, an affliction on top of the skin,
That's a
as
great
opposed
question.
to beneath?
So the indications for Mohs really are skin cancers, predominantly of the head and neck area,
Okay.
or an area or hands, feet, genitalia, places where skin is certainly a priority, and cosmesis is very, very important. But we also perform Mohs surgery on areas of the trunk and extremities for skin cancers that might be larger or a more aggressive subtype.
Okay, so again, the idea is for cosmetic, you want to try to, when it's all said and done, leave minimal scarring, right?
Absolutely,
Yeah.
absolutely. So the smaller the defect, the smaller the resulting scar, which
Okay.
is another added benefit of the procedure.
Real quick, what are some other options people might have if they come across something?
Absolutely. So certainly, if you have a concerning lesion, it should be checked, perhaps biopsied, if need be, by a dermatologist, a board-certified dermatologist. Various treatments for skin cancers range from sort of the Cadillac, or the highest technological advancements for Mohs surgery, also just regular surgery and excision. Sometimes if the skin cancer is very small and thin, we can do something called electrodesiccation and curettage, which is where the cancer is gently scraped away.
Okay.
And there are also creams that can be used if it's a very superficial or thin and small cancer.
Okay, when people come across a skin cancer, it is curable. It is fightable.
Absolutely, absolutely. Non-melanoma skin cancers like basal cells and squamous
Okay.
cells have over a 98% cure rate. And melanoma also has a 98% cure rate if caught early. But the key is diagnosing these lesions early.
Okay, thank you so much. We're going to have more all morning long. We're talking proper skin care. Just based on the area we live in alone should be cause for concern and awareness. That is coming up all
The
morning
other way.
long. That's it for now. Back to you.
All
All
right,
right.
thanks so much, Craig. Good information there this morning.
I know that you can get sunburned so easily and damaged so easily because of the altitude. So
Yeah.
it's getting some important information.
Stay
this morning.
protected. Not a lot of sun today, but either way, still can
That's
burn
right.
very easily. So.